Hi, I'm Dr. Lucky Seekon, a double board certified OBGYN and REI, and I want to tackle a commonly asked question. Do I need a mock cycle? So what the heck is a mock cycle? A mock cycle implies that you're taking medications as if you're preparing your body for an embryo transfer, but then you do not actually move forward with an embryo transfer. So this involves taking meds for usually about a month and then stopping them and getting a withdrawal bleed and never actually moving forward. So it's a whole month of your time, it's taking medications and then not moving forward. Now, this is often done as part of testing like ERA or receptiva. But when I talk about doing mock cycles, I really don't do those tests because there is a lack of evidence for them. And it's just not something I have incorporated into my practice because I have yet to have a real reason to. But I do mock cycles, especially in scenarios where I've never seen how someone's lining behaves firsthand in response to stimulating the ovaries where there's high estrogen levels, or just giving them estrogen, or even seeing how their lining behaves in their own menstrual cycle. This is really important in scenarios like patients who are electing to use donor egg. I've never had them go through a retrieval. When I have patients going through IVF and the first part is the retrieval to get the eggs out, we're always measuring and noting what the lining is doing, and we save all the pictures. So I don't need to do a mock cycle. In the donor egg IVF scenario, someone is committing to purchasing donor eggs and fertilizing them, turning them into embryos. I want to make sure, especially if they have a history like prior fibroids or uterine surgeries, I want to make sure that I'm going to be happy and feel like their lining is sufficient and they can actually respond well to the medications required to prepare for transfer. So I will often do a mock cycle just to see how the lining behaves and to make sure we feel confident and that we can rectify any issues before we move forward. I think it used to be historically much more important to do this even before IVF using your own eggs, because so many transfers were done fresh a week after the egg retrieval. But now most of the transfers we do are frozen, and so we can kind of treat the retrieval cycle like a mock cycle. So if you hear this term being thrown around, but it's not something that's been suggested for you, know that it doesn't always need to be done. There's very specific scenarios where it makes sense. And if you're doing those specialized types of tests we talked about, maybe then it makes sense too. But outside of that, I wouldn't say that it's a routine step, and it could just pose as an extra month that you don't really need to be doing anything. And I tend to just go straight into the transfer prep as long as there's no concerns.